The U.S. government is preparing now to send out payments from that huge stimulus package. News 13's Stephanie Sanastasi joins us now live in Asheville. And Stephanie, what do people need to do to make sure that they get their check?
Well, for most people, you won't need to do anything. That money will appear right in your checking account. However, for those people that don't have to file taxes, the owner here says there is some action you'll have to take. If you're behind on filing your 2019 taxes, now might be a good time to get caught up.
The hopes of having a little bit of financial relief is going to be a positive impact for a lot of people.
We spoke with the owner of the Liberty Tax off Brevard Road via Zoom today. Candace Byers says lately she's had a lot of people inquiring about those stimulus checks.
The biggest question is, when am I going to get my money? And unfortunately, we don't have an exact release date at this point.
According to the IRS, anyone earning up to $75,000 in adjusted gross income and who has a Social Security number will receive a $1,200 payment. That means married couples filing joint returns will receive the full payment of $2,400. Parents will also receive $500 for each qualifying child.
The stimulus is to be determined by current filing status, current household size, current direct deposit information on the 2019 return.
So if you haven't filed yet, there's a chance that might not be correct.
The earlier you file, the earlier they have your up-to-date information, and that way you don't run any risk of your stimulus being affected by them having to go back to 2018 and maybe they're not being accurate information.
Finally, for those not required to file tax returns, such as low-income taxpayers or senior citizens, you will need to file a simplified tax form first in order to receive payment. And Byers says the sooner you get this done, the better.
That's why we've put into place some of the other options that we have so that people can still file.
Public health officials are now reconsidering who should be wearing face masks in public. Some think everyone should be wearing them. News 13's Caitlin Penner spoke with Buncombe County officials about this question. And Caitlin, they say this is happening because of people with the virus who aren't actually showing any symptoms.
Exactly. It's called asymptomatic carriers. Officials say you still shouldn't be going outside, but soon you could need a face mask.
I think the most critical thing is that, we need to make sure that surgical masks and N95s are used for healthcare providers.
Although local and state officials continue to stress the need for masks for those on the front line.
Supply lines are tight here, and so all masks really need to be going to our healthcare workers, our first responders, those that are working in our higher risk settings.
Officials say they're waiting on possible new guidance from the CDC regarding personal face mask use.
I can tell you that the White House Coronavirus Task Force has the CDC looking at the issue of masks as a protective measure right now.
There's still a lot we're learning about asymptomatic transmission. So people who don't have symptoms, what is their contribution to spreading the germ?
Currently, the CDC recommends that people should wear face masks only if they are sick or caring for someone who is sick, citing that there could be a shortage of face masks, in which case they should be reserved for healthcare workers. But now that people could unknowingly have COVID-19, that could change.
And so I think that's where the discussion about masks is leading. Like, do we want, not we, but is the general public health guidance going to be that everybody wear a mask because we don't want people to be transmitting infection when they don't have symptoms. And
officials stress, however, that even if everyone starts wearing face masks, people need to keep taking the same precautions.
So we're never going to get away from this, our new normal of washing our hands, using disinfectant, wiping down surfaces.
Now, the World Health Organization guidelines are similar to the CDC's in that they only say that people should be wearing masks if they're sick or caring for someone who's sick.
News 13 is working hard to answer your questions about the coronavirus. And last week, we found out that the flu vaccine does not help protect against the virus. This week, a viewer asked, although you told us about the flu vaccine not being of any help with the virus, what about the pneumonia vaccine for the pneumonia associated with the coronavirus? Well, we reached out to the local hospitals here in Western North Carolina. Advent Health recently sent us a response. Infectious disease specialist Dr. Seema Lagvankar said this: influenza and pneumococcal diseases are separate diseases and disease processes that each have their own respective vaccinations. Coronavirus is yet another separate disease and is not related to influenza or pneumococcal diseases. This morning, a much-needed surprise arrived at the ER at one Henderson County hospital. 13-year-old Charles Hopp delivered gift bags to Advent Health doctors and nurses. Inside each bag was a drink, some snacks, and a special letter of encouragement. He participates in the Congressional Award Leadership Program, and when the COVID-19 pandemic began to impact people here, he decided he wanted this to become the focus of his voluntary public service goal.
I'd been reading about COVID-19, and I know that everybody here is at a great risk, and so I wanted to do this to show my appreciation for everybody here.
And he couldn't go into the hospital, so staff brought the bags in to give it to the medical workers. He put together 60 for all those working on the front lines.